There are definitely those patients who come in who are against surgery and don't even want to address it, in which case we don't address it unless we need to. And then there's others who really have tried and tried non-surgical weight loss umpteen times throughout their lives, and it has become clear to them that they need to do something more. So a successful treatment plan does include a multidisciplinary team. As the medical doctor, I'm able to counsel my patients, but I'm also able to provide prescription medications when and if necessary. In addition to that, I utilize my dietitian's help in reinforcing the dietary or lifestyle counseling that I have initiated or provided in the office. There's this significant component of emotional eating in which needs to be addressed in order to achieve successful weight loss. In those circumstances, we engage our behavioral specialists to help us with addressing the emotional issues and, again, supporting the behavioral change that we've prescribed. And then finally, there are the bariatric surgeons that are part of the team in that subset of patients who are candidates for bariatric surgery. And then some of these patients have other psychosocial issues that develop following surgery. This has been a life change for them, and family members may or may not respond well to that change. They personally may or may not respond well to that change. So again, you have to engage the behavioral specialists to help. So it truly is a multidisciplinary effort that engages all the members of the team, not only in the pre-treatment phase, the active treatment phase, but also the post-treatment phase in order to ensure success in these patients. So the epidemic of obesity is daunting. A significant proportion of our adult and child population in the United States is overweight or obese. I don't think the message should be one of fear, because small changes in lifestyle, small changes in weight result in significant benefit to individuals' health. Don't be shy or afraid of tackling this condition, because you have everything to gain from even small amounts of weight loss or small changes in your lifestyle. When we talk about what is the future of obesity, I really don't think you can pin it on any one thing. We have to really be unique in our prescription of treatment to the patient. I think bariatric surgery plays a role. I think pharmacotherapy and medications for weight loss are going to play a bigger role, because we have had, again, this gap in our treatment options historically that has not addressed pharmacotherapy. And we are addressing that gap by having more medications at our disposal. But what's becoming clear is that in order to successfully treat obesity or affect appetite, you have to affect different inputs and not just one. In fact, the mechanism by which bariatric surgery works is by affecting hormonal change. We have huge barriers in regards to third-party payers and them approving these medications and paying for the treatment options. In many cases, obesity is actually an exclusion in insurance or health plans, and so it's not even an option for these things to be covered. There's a lot of change happening, though. Professional organizations are becoming better about educating Congress and legislators about the need for reimbursement for these treatment options. And so I do think it's changing, but it is a very slow shift. We know that obesity taxes the health system at over $200 billion a year. It's associated with significant collateral damage, absenteeism from illness, and other things in the workforce. We will be addressing the tenets of the Affordable Care Act, which is prevention. But right now, what we're saying doesn't match what we're doing. We say that we're promoting prevention. We say that we want physicians to engage in preventative services. But we are not approving the means by which we can prevent diseases from occurring by treating obesity. It's very important for people out there to recognize that you can achieve so many benefits in health through really small changes in diet, exercise, and weight. Oftentimes when a patient comes in, they have a weight loss goal of 50 pounds, 60 pounds, 100 pounds. Sometimes that's achievable, sometimes it isn't, but even 10 pounds or 20 pounds will improve the health of that patient. When you are ready to tackle this health problem, there are effective treatment options at your disposal, and you can achieve better health through losing weight.